Hello, fellow pigeon fanciers. Welcome back to the channel. I'm here today to talk about something that keeps every racing pigeon breeder awake at night: disease outbreaks in our lofts. If you've been in this hobby for any length of time, you know that one sick bird can quickly become a disaster that affects your entire racing season, or worse, your entire breeding program. I've seen too many heartbroken fanciers who've lost prize bloodlines because they didn't recognize the warning signs early enough. Today, we're going to cover the top 5 deadly diseases that can devastate racing pigeon lofts. More importantly, I'm going to show you exactly how to prevent them and what to do if they do show up in your birds. Trust me, prevention is always better than treatment, and it's certainly less expensive than replacing your entire stock. So grab a cup of coffee, and let's dive into what every serious pigeon fancier needs to know about keeping their birds healthy and competitive. Paramyxovirus, PMV. Let's start with the big one, Paramyxovirus, or PMV as we call it. This is probably the most feared disease in racing pigeon circles. And for good reason. PMV is a viral infection that attacks the nervous system and can spread through your loft like wildfire. Now here's how this nasty virus spreads. PMV is highly contagious and passes from bird to bird through respiratory droplets. Basically, when infected birds cough or sneeze, it also spreads through contaminated feed, water, and even on your hands and clothing if you're not careful. Wild birds, particularly corvids like crows and magpies, can carry and spread the virus too. The symptoms of PMV are unmistakable once you know what to look for. You'll see birds with twisted necks, that classic head tilt that makes them look like they're constantly looking over their shoulder. They'll have trouble flying, often crash landing or flying in circles. Some birds will show tremors, particularly in their heads, and they'll have difficulty eating and drinking because they can't coordinate their movements properly. Why is PMV so dangerous? Well, if left untreated, this disease can wipe out your entire loft. The mortality rate can reach 80% or higher in unvaccinated flocks. Even birds that survive often have permanent neurological damage that ends their racing careers. But here's the good news. PMV is completely preventable with proper vaccination. Every racing pigeon should be vaccinated annually with a killed PMV vaccine. I usually vaccinate my birds in late winter, about 6 to 8 weeks before breeding season starts. Young birds should get their first vaccination at around 6 to 8 weeks of age, then a booster 3 to 4 weeks later. Beyond vaccination, strict biosecurity is crucial. Quarantine any new birds for at least 30 days before introducing them to your main loft. Keep wild birds away from your feeders and water sources, and always wash your hands between handling different groups of birds. If PMV does hit your loft, unfortunately there's no specific antiviral treatment. Supportive care is all we can offer. Keep affected birds warm, hand feed them if necessary, and provide electrolyte solutions. But honestly, vaccination is so effective that you should never have to deal with this scenario. Salmonellosis, Paratyphoid. Moving on to our second deadly disease, Salmonellosis, which we often call Paratyphoid in pigeons. This bacterial infection is caused by Salmonella typhimurium variant, Copenhagen, and it's one of the most common causes of fertility problems in young bird mortality in racing lofts. Salmonella spreads primarily through the fecal-oral route. Infected birds shed the bacteria in their droppings, contaminating feed, water, perches, and nesting materials. The bacteria can survive for months in dried droppings, making thorough cleaning absolutely essential. Adult birds can be carriers without showing symptoms, which makes this disease particularly tricky to manage. The symptoms of Salmonellosis vary depending on whether you're dealing with acute or chronic forms. In young birds, you might see what we call going light. They lose weight rapidly, become lethargic, and develop watery greenish droppings. Adult birds might show fertility problems with eggs failing to hatch or chicks dying in the shell. You might also notice joint swellings, particularly in the wing and leg joints, and some birds develop a characteristic head tilt. Here's why Salmonellosis is so insidious. Many adult birds become chronic carriers. They look perfectly healthy, but continuously shed bacteria, infecting other birds and contaminating the environment. These carrier birds often have reduced fertility and their offspring frequently die young, which can slowly destroy your breeding program over several seasons. Prevention starts with excellent hygiene. Clean water is absolutely critical. Change it daily and use closed systems that prevent contamination. I can't stress this enough. Dirty water is the #1 source of Salmonella transmission in pigeon lofts. Keep feed in covered containers and remove any spillage promptly. Regular testing is also important. Have your birds tested annually, particularly before breeding season. Many vets can perform quick crop swabs or fecal tests to detect Salmonella carriers. For treatment, several antibiotics are effective against Salmonella, including enrofloxacin and chloramphenicol. However, treatment should always be based on sensitivity testing because antibiotic resistance is becoming more common. The key is to treat the entire flock, not just symptomatic birds, because of those sneaky carriers I mentioned. One experienced fancier I know learned this lesson the hard way. He had great racing birds but couldn't understand why his breeding results were so poor. After testing revealed widespread Salmonella infection, he treated his entire loft and saw his fertility rates jump from 60% to over 85% the following season. A Canker Trichomoniasis. Now let's talk about Canker, also known as Trichomoniasis. This is caused by a single-celled parasite called Trichomoniasis gallininae, and it's probably the most common disease we see in racing pigeons. While it's usually not immediately fatal like PMV, chronic canker infections can seriously compromise your bird's racing performance and overall health. Canker spreads primarily through contaminated drinking water and crop milk. Adult birds can pass the parasite to their young when feeding them, and birds drinking from the same water source will infect each other. The parasite cannot survive for long outside the host, but it spreads very quickly in crowded conditions with shared water sources. The classic symptom of canker is the yellowish cheesy plaques you'll see in the mouth and throat. We call these canker spots. Birds might have difficulty swallowing. You'll hear a clicking sound when they breathe, and they may shake their heads frequently. In severe cases, you might see swelling around the head and neck, and birds will go off their feed. Young birds are particularly susceptible and can die quickly if the infection blocks their throat. But here's what many fanciers don't realize. Canker can also cause internal infection. You won't see the obvious mouth lesions, but birds will have reduced performance, weight loss, and general poor condition. These subclinical infections are often overlooked, but can seriously impact racing results. Prevention of canker comes down to water management. Use acidified water with apple cider vinegar, about 1 tablespoon per gallon. This creates an environment that's hostile to the Trichomoniasis parasite. Clean water systems thoroughly at least twice a week, and use separate drinkers for different groups of birds when possible. Many successful fanciers use preventive medication during high-stress periods. Ronidazole is highly effective against canker and can be used preventively before races or during weaning. However, never use it during active racing as it can affect performance. For treatment, several medications are available including metronidazole, ronidazole, and carnidazole. Treatment is usually given for 5 to 7 days, and it's important to treat the entire loft, not just affected birds. I remember visiting a loft where the owner complained his birds were consistently finishing in the back third of races. After examining several birds, I found widespread subclinical canker infection. After treatment and improved water management, his race results improved dramatically. Some of his birds moved up 100 pause positions in standings. Disease and 4. Pigeon Pox. Let's move on to pigeon pox, a viral disease that comes in 2 main forms, dry pox and wet pox. While pox might not sound as scary as some of the other diseases we've discussed, it can seriously impact your racing season, and its wet form can be quite deadly. Pigeon pox spreads in several ways. The dry form typically spreads through skin wounds, mosquitoes and other biting insects or common vectors. Birds can also get infected through scratches from contaminated perches or fighting with infected birds. The wet form spreads through respiratory droplets and contaminated feed and water, similar to other respiratory diseases. With dry pox, you'll see characteristic scab-like lesions around the eyes, beak, and on the feet and legs. These look like small, dark, crusty bumps. While unsightly, dry pox is usually not life-threatening, though it can affect vision if lesions develop around the eyes. Wet pox is much more serious. This form affects the mouth, throat, and respiratory system. You'll see yellowish diphtheritic membranes in the mouth and throat, somewhat similar to severe canker. Birds have difficulty breathing and eating, and mortality can be significant, especially in young birds. The danger with pox is that it compromises the bird's immune system, making them susceptible to secondary bacterial infections. Additionally, birds with active pox lesions cannot compete effectively. They have reduced vision, breathing difficulties, or problems with their feet. Prevention focuses on mosquito control and maintaining good hygiene. Use screened windows during mosquito season, eliminate standing water around your loft, and consider using mosquito control products. Keep perches clean and dry, and remove any with rough or splintered surfaces that could cause scratches. Some fanciers vaccinate against pigeon pox, particularly in areas where it's endemic. The pox vaccine is applied by the wing web method and provides good protection for 1 season. There's no specific antiviral treatment for pox, but supportive care helps affected birds recover. Keep lesions clean, apply antibiotic ointments to prevent secondary infections, and ensure birds continue eating and drinking. Most birds recover from dry pox within 2 to 4 weeks, but wet pox often requires more intensive supportive care. A friend of mine had a pox outbreak just 3 weeks before his most important race of the season. While he couldn't race his affected birds, he learned valuable lessons about mosquito control and now takes preventive measures every summer. He hasn't had pox in his lofts.
E. coli infection.
Finally, let's discuss E. coli infections. While E. coli bacteria are normally present in the pigeon's intestinal tract, certain pathogenic strains can cause serious disease, particularly in young birds and those under stress. E. coli spreads through contaminated feed, water, and environment, particularly where fecal contamination is present. Overcrowding, poor ventilation, and stress all predispose birds to E. coli infections. The bacteria can also ascend through the reproductive tract, causing fertility problems in egg peritonitis in hens. Symptoms of E. coli infection include watery, sometimes bloody diarrhea, lethargy, loss of appetite, and rapid weight loss. Young birds may die suddenly with few warning signs. In breeding hens, you might see egg binding, soft-shelled eggs, or egg peritonitis where the hen becomes egg-bound and develops abdominal swelling. E. coli infections are particularly dangerous because they can quickly lead to septicemia. Blood poisoning. Young birds can die within 24 to 48 hours of showing first symptoms. Additionally, E. coli often occurs as a secondary infection when birds are already compromised by other diseases or stress. Prevention is all about hygiene and stress management. Maintain clean, dry loft conditions with good ventilation. Keep feeders and drinkers clean and positioned where they won't be contaminated by droppings. Avoid overcrowding and minimize stress during critical periods like racing and breeding. Water quality is crucial. E. coli thrives in stagnant, contaminated water. Use automatic waterers when possible and clean them regularly. Consider water acidification or erotic sanitization with appropriate products. Treatment involves antibiotic therapy, but sensitivity testing is important because E. coli resistance is common. Supportive care with electrolytes and probiotics helps restore normal gut flora after antibiotic treatment. Treatment should be prompt. Waiting even 24 hours can mean the difference between recovery and death in severely affected birds. I've seen several cases where young birds being trained for their first races developed E. coli infections after being stressed by longer training tosses. The lesson here is to build training intensity gradually and pay extra attention to hygiene during training season. All right, fellow fanciers, we've covered a lot of ground today. Let me give you a quick recap of the key prevention principles that will keep your loft healthy. First and most important, biosecurity. Quarantine new birds for at least 30 days, limit visitors to your loft, and always use foot baths and hand washing protocols. Second, clean water is non-negotiable. Change it daily, use closed systems, and consider water acidification during high-risk periods. Third, vaccination and testing. Keep up with PMV vaccinations, test annually for diseases like Salmonella, and work with an avian veterinarian who understands racing pigeons. Fourth, daily observation. You need to know your birds well enough to spot problems early. Check droppings, watch eating and drinking behavior, and handle your birds regularly. Finally, stress management. Avoid overcrowding, maintain good ventilation, and don't push birds beyond their limits during training. Remember, prevention is always cheaper than treatment, and it's certainly less heartbreaking than losing birds you've spent years developing. The small investment in proper management pays huge dividends in bird health and racing performance. If you found this video helpful, please hit that subscribe button and ring the bell for notifications. I post new pigeon health and management content every week. Leave a comment below telling me about your experiences with any of these diseases. Your stories help other fanciers learn. Also, if there are specific topics you'd like me to cover in future videos, drop me a comment. I'm always looking for ideas that will help our pigeon community. Next week, I'll be discussing nutrition for peak racing performance, so make sure you're subscribed so you don't miss it. Until then, keep those birds healthy and happy, and I'll see you in the next video. Fly safe.